Welcome to Wellness by Designs. I'm your host, Andrew Whitfield Cook. And joining us today is Belinda Kirkpatrick, a naturopath and nutritionist who specialises in fertility management. And we're going to be discussing today the benefits and uses of nicotinamide riboside, or NR. Welcome to Wellness by Designs. Belinda, how are you going?
I'm well, thank you, Andrew. Thank you so much for having me.
Thank you so much for your time today. So I guess to start off, really, what is NR? And by the way, we were always going to say NR. Everybody shortens it, but it's nicotinamide. So the non-flush form of B3 combined with riboside. So nicotinamide riboside, but we're going to say NR. We'll always default. So what exactly is NR and why is it used in fertility?
Yeah, NR, you're right, we never actually say the word, is one of my favourite supplements. So NR is a precursor for NAD+, or nicotinamide adenine dinucleotide, and that's a compound naturally produced in the body. Now, this NAD+ is essential for processes, things like, energy production, DNA repair, gene expression, and the levels decline as we age. So it's been looked at a lot as sort of like an anti-aging thing. So we've got it in bucket loads when we're young and full of energy, and it starts to decline in our 30s and beyond. So NR that we're talking about today is a precursor for this NAD, which is super essential, and it's known to boost NAD levels. So in my practice, I'm using NR a lot to address like age-related ovarian fertility issues, maintaining and improving egg quality.
Okay, could you just explain for us why, as a naturopath and nutritionist, you choose NR over NMN, which is nicotine mononucleotide? NMN, we always do that to produce NADH or NAD+. What's the benefits of NR over NMN?
It's such a good question, and it's such a confusing thing, and I've done so many deep dives kind of down into it, because it's like, why are we not, if we want NAD+, why are we not just using NAD? And then we've also got the NMN form, or the nicotinamide mononucleotide, or the NR. So when we're looking at NAD, it is very unstable. It's degraded very quickly in light, whereas NR is more stable. And then NMN is kind of closer structurally to NAD, what we want to finish with. However, both NMN and NAD are quite big molecules, and they find it quite difficult to cross into the cell. So if you take NMN, it's actually converted back to NR before going into the cell to then become NAD. So I guess it's like an extra metabolic step that some people may do easily and some people don't. So the NR form, like you said, is the non-flushing form. So it's basically, the closest in structure to NAD, but while still being able to cross into the cells and being converted back into NAD, and it's been shown to raise cellular NAD levels significantly.
I think this is one of the issues we've always got to be cognizant of, and that is that when we're talking about a molecule that's in the cells, is that relevant for oral supplementation of that molecule? Because we've got a whole digestive process, first pass metabolism, it's got to be taken into the liver, processed, and then taken to the cells, or the target organs, if you like, to be used there. So taking it orally in the mouth doesn't necessarily mean that it gets to the target organ or target cells in that form or in that dose. So we've got there's a few relevant steps we've got to think about, right?
Absolutely. And the less steps that we need to take, then we're not then relying on somebody's, personal sort of genetic ability to actually convert things back and back. So the more, steps that there are, the more places there could be issues.
Yeah, that's a really good point you make, actually, about genetic ability, because often we find these are the people, for instance, P5P, these are the people that have issues with phosphorylation and dephosphorylation. And so in some people, maybe with liver assaults or chronic fatigue, for instance, these are the people that tend not to be able to use pyridoxine hydrochloride, and they sometimes do better with P5P, whereas most people can convert pyridoxine hydrochloride no problem. Do you find that with your use in practice, that there's a certain population that NR is better suited for?
It's a great question because absolutely in so many other kind of like formats, I pretty much just use that solely because we know that it is the most easily absorbed form. So there probably
Gotcha.
are genetic SNP tests and all these sorts of things that you can probably have a look at. I actually haven't done that dive down into that. Just knowing that I guess that the NR actually does go into the cell pretty easily and get converted into NAD. So I think there'll always be patient subgroups that do that more effectively than others. But yeah, I'm basically just using the NR form, to be honest.
Yeah, cool. And so talking about fertility, because these are I mean, these people are crying out. They spend thousands. They go through months and months and years of anguish. Um, can you explain the function of NR in fertility management in both females and males?
Yeah, absolutely. So I think it is really important to note that like a lot of the research that we're basing this data on does come from predominantly mice. There are a lot of them animal studies. There is research in humans that's ongoing.
Hmm.
There's the enhanced study here in Sydney that's looking at the effects of NR supplementation, in the IVF cycle and equality and all that kind of stuff that is still kind of ongoing. So a lot of the research is using aged mice and things like that. But I think that the research in humans will become more and more. Certainly clinically, I've been using it for many years and really noticing a huge difference with it. So NR has kind of a few roles in fertility. Most importantly, I think for lots of our patients is basically just overall improvement in egg quality. So it can improve the quality of eggs. It basically works by enhancing mitochondrial function, and we know that the egg donates the mitochondria to the embryo, so really important that mitochondrial health of the egg is really important. As we age, that mitochondria often doesn't function as well. So enhancing mitochondrial function, reducing oxidative stress, and helping to maintain sort of normal chromosomal structure. NAD also activates these enzymes called sirtuins, and if you work in fertility, sort of these sirtuins are kind of like big enzymes there, and they're basically involved in DNA repair. So that can then help to boost like egg and sperm as well, integrity. So we're really wanting to boost that sirtuin pathway. Without getting too technical, because I'm actually not a super technical kind of person, but there's also in the cells, we've got this thing called another enzyme called CD38. Now, this enzyme basically is the primary NAD plus consuming enzyme in the ovaries. So it gets higher, or it expresses more activity with age, which contributes to these declining NAD levels, follicle depletion, reduced fertility. So the NR supplementation can't stop this CD38 from increasing with age. That just happens. Maybe there's something else that I don't know about that does that. But it basically can elevate these ovarian NAD plus levels, which then helps to kind of mitigate the kind of consequences, I guess, of this sort of CD38 driven depletion. So it really is kind of getting a little bit technical there, but it's actually kind of helping to reduce something, or it's helping to balance something that is causing egg and ovarian aging.
Can I ask about dose? So do you
Yes.
find that as we age, for instance, that the dose of NR has to be escalated? Do you find maybe certain conditions, certain types of
Yeah.
aberrations with oocytes that that NR is that you use different doses for?
I certainly do use a higher dose in sort of, I guess, what they would call poor responders. So basically people who either don't respond well to IVF cycles. And that's where we can sort of really see egg quality is really in that assisted reproductive setting. Do you know what I mean? Like, as women get older, when they're trying naturally, we definitely assume that there's an egg quality component there once people start to get over 38, 40, 42, lots of my patients are over 41, 42, 43, 44, so we know that, egg quality probably isn't going to be amazing then. So I will often use the higher doses at that point. If they've been doing IVF and, we can see the specialist or the embryologist kind of giving feedback about egg quality, or the eggs aren't, that sort of fertilization to day 3 embryo is very egg quality driven. So if we're not seeing kind of much movement in that embryo progression from day 1 to 3, I will often kind of increase the dose as well. So, depending on where they are and how old they are and things like that, I think because we can't measure egg quality, we kind of essentially, we start off with a bit of a stab in the dark based on their history and their age. And then if they are moving into the assisted reproductive sort of IVF world, we get a lot more information on that. So yeah, I definitely will use higher doses in people with sort of seemingly poorer egg quality.
Right, got. And what about its use as well a metabolic balancer and as an anti-inflammatory? Like I've heard of its use in polycystic ovarian syndrome.
The other thing too, just with the egg quality, because I think that's something that like people are like super interested in. It also can also research has shown increase and stimulate ovarian follicle growth. So really important. There are some animal studies that I love as well that shows that the NR increases the proportion of embryos reaching those advanced developmental stages, so day 5 and beyond, so giving I guess better IVF outcomes, and also in mice increased live birth rate. So it really does seem to kind of really give a lot of health to that egg. I guess getting that reproductive potential sort of protected, but and all the way through. Anyway, I just thought I'd throw that in there. With PCOS, I've sort of started using it a little bit for PCOS. Look, mostly in the setting of fertility and PCOS, but I can see where it is starting to kind of show some promise in sort of managing PCOS, even people who aren't necessarily trying to conceive. It does work as an anti-inflammatory. It reduces that oxidative stress, so that's kind of, reducing inflammation there, increasing again the mitochondrial health that I talked about before. And it also does a few things, basically, helping with the cellular metabolism, increasing ATP function. So a polycystic ovary is generally a pretty inflamed ovary. So, there's lots going on there, and there's generally a level of inflammation. So really, reducing those ROS or reactive oxygen species can really help to reduce any cellular damage that's being caused by inflammation. It also too helps to reduce ovarian fibrosis, or these fibrosis-associated genes, and that's going back to that sort of activation of that SIRT1, SIRT3 kind of pathway. So really enhancing ovulation and reducing fibrosis, reducing inflammation, really is working on a part of PCOS.
Yeah, sure. And obviously alongside other therapies like myo-inositol, exercise, weight loss, blah, 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 yeah?
Yeah, depending on, what's going on, testosterone, inflammation, insulin resistance. So as a part of a treatment, I can absolutely see where that's going to play a role.
Yeah, sure. And what about, you were mentioning the IVF sort of process previously. If we think about temporal dosing, like when can you, and are there any times where you shouldn't use NR with regards to the IVF cycle or the IVF process? When do you use it? When do you hold back?
I use it all the way up until an egg collection. So it's not something that is going to be contraindicated with IVF medications, which is fantastic. It doesn't, increase estrogen, like sometimes ubiquinol at very high doses can. So sometimes we drop back the, ubiquinol dose sort of in that sort of IVF cycle. So, I'm using NR like all the way up until kind of egg collection. Now, they sort of say, what gets you pregnant keeps you pregnant. So, I'll often drop the dose back and actually use it for a little bit longer after that in certain women, depending on, sort of oxidative stress, inflammation. But yeah, so it's not, it's not shown to affect implantation, which is obviously a good thing. So you can be using it kind of all the way through, but that real, I guess, you don't have to be sort of stopping it before they start their IVF stimulation medication, which is great.
Gotcha.
And in that,
I'm just going to segue.
Yeah. Yeah,
Begin.
in
You
that
go.
enhanced study, they're actually using it. It's only 6 weeks. I think it probably does need to be longer, but hopefully that's the beginning of many studies. But they use that all the way up until egg retrieval or their trigger injection. So, yeah, that sort of gives you a lot of confidence too that IVF doctors are running a trial and actually kind of using it up until egg retrieval.
Gotcha. Tell us a little bit more about this enhance study.
Yeah, so it's a study that they're doing. I think they're doing from memory. I think it's like 250 milligrams, which is a low dose, and 1,000 milligrams daily, and it's 6 weeks up until egg retrieval. So I guess that's kind of 4 weeks before they start their stimulation, and then they say sort of 2 weeks during stimulation, which some women won't get to 2 weeks. So I mean, look. Yay for any studies, because it's so hard to get research, particularly in these patient groups, right? I mean, I'm not part of it at all, but I'm guessing if you say to somebody, would you like to be part of the study, you might have this, this nutrient that has been shown that we think might help egg quality, or you could have the placebo. I'm going to guess a certain big chunk of them jump out of the study and go and take it anyway, but I mean, I don't know. So I'm guessing it's probably hard to get kind of big studies. I would love there to be a study that was taking it for at least 3 months. But the start of anything is amazing, and often then obviously if there's some promise shown there, like there are in the mice and animal trials that they've been doing for a long time, hopefully then it gets to be bigger and longer and those sort of things.
Yeah, but I know this happens rarely, and wouldn't it be great if this did? But I have heard of trials that were stopped early because the results were so dramatic, so blindingly dramatic for people that it was unethical to continue taking the placebo. It was,
It would be amazing.
wouldn't it be great if that was the case? That'd be awesome.
Amazing. And it is so hard, I guess, with naturopathy, isn't it? Because it's often sometimes we get these single nutrients or these single, coenzymes that are just amazing and show improvement and things like that. But there's always so many other things kind of going on that you're like, we know that protein's so important for kind of egg quality. We know that, so I guess diet and lifestyle and everything, even if it's not with other supplements, I mean, it would be amazing to kind of be able to sort of capture all that together. But yeah, you're right. I mean, gosh, if you could go, 1,000 milligrams for 6 weeks before showed any improvement, and then you went on to a bigger study that did it for longer or added in something, I think, I can't imagine that you wouldn't see it, because I see it in clinic all the time.
Yeah. I guess the danger is wanting a nutrient to be a drug, because drugs are very powerful agents which block or upregulate things dramatically, often with attendant side effects. Nutrients are things that we've evolved to handle, so it's a little bit of a different ball game. It's hard to ask something over a short period of time to have.
Yeah, I don't know how it shows the group, but I mean, how you choose that, are there other issues? Is it just anyone doing it? Was it people who had sperm issues as well, but they may as well take this to improve it? I mean, I actually don't know those details, so maybe that's all fine-tuned out in the study. But
So we've mainly spoken about egg quality so far.
Mm-hmm.
What about sperm quality? What about males?
Yeah, so it is good. I mean, in that same sort of way, it is good for sperm quality as well. So a lot of the research that we use for egg quality and also kind of sperm quality is based on anti-aging research, right? The amount of my patients who, on ubiquinol and they're on resveratrol or they're on nicotinamide riboside and all these kind of, beautiful antioxidants that we've got. And then once they're pregnant, they're kind of like, oh yeah, my husband wants to kind of buy those now. Is it okay for him to take them, like all the guys at the gym, or he's listened to some Huberman podcast, or so it's it's really, it makes you realize they're like, what, you've got NR? My husband's asking me why I've got this type of thing, because it really is so much the bulk in that anti-aging kind of research. So men and women, a lot of the issues is this sort of DNA damage, poor mitochondrial kind of health, inflammation, aging eggs, aging sperm. So anything that does kind of boost the sort of health of the egg and help with DNA repair, which is such a thing as we kind of age, it definitely does play a role there. So I don't know that there's as much research on it as yet, but I think it's the next ubiquinol, if it's not already.
Right. Isn't it funny that it took going to the gym to start men to realise that there was a
Yeah.
function for these anti-aging nutrients? I think that's funny.
Yeah.
And you also mentioned ubiquinol, so we may as well cover off on that because, like, I can remember Ruth Trickey was like the
Yeah.
first, let's say, fertility specialist who really grasped the use of this. And I remember her saying, on the basis of one small trial, she started to use it, and
Oh,
then it became mandatory. It became
yeah.
just general approach. So take us through ubiquinol while we're there. What dose do you use? When do you use it? Are there times when you don't? You mentioned sometimes you might pull back.
Mm,
And
yeah.
both males and females for it too. Yeah.
Yeah. So I do tend to use ubiquinol, the more active version of kind of CoQ10. You do tend to kind of get what you pay for in that sense. And again, going back to our conversation about, like how people can kind of break it down and convert it, is that not everybody converts CoQ10 into ubiquinol, actually quite a small proportion. So I do tend to kind of go upstream and go with ubiquinol. So again, depending on their age and history and IVF history and what have you. But like the dose that sort of sits well in most of the research is about 600 milligrams a day, which is a pretty decent dose in terms of cost, right? Like, I mean, ubiquinol, I mean, the same with NR, they're beautiful in the sense that they fit into a nice little teeny tiny capsule and they're swallowed easily and digestion feels great. And, they're not sort of your B vitamins and they're not your, taking 4 or 6 fish oil a day. So like they're expensive, right? So it's like it's like gold in a little, it's like gold in a little capsule. So sometimes, you are trying to kind of choose and sometimes, you really want to, I guess, use better doses of less things, rather than sort of spreading yourself too thin. The amount of people that come having read whatever sort of certain books that are great for getting people started on their egg health journey, that are taking, ubiquinol and have been taking it for a long time off the internet or whatever, just kind of self-prescribed. It's quite amazing without knowing what the issue is and is it the dose, is it the amount, is it whatever's in there, is it how it's processed? But they'll be like, I've been doing ubiquinol for kind of ages. And you're like, can you just give me a few months on a different type and or dose, and they do get better results. As we mentioned before, they're obviously doing lots of other things as well, but it is important. So if that was sort of younger, as in like maybe under 38, maybe I'd just do 300 milligrams of ubiquinol, right? Particularly if they were just trying naturally. But if anybody's going into the IVF setting, I'm like, even if it's their first attempt and they're, 37, even if there's not a known reason and it's a suspected egg quality, i.e., doesn't look like implantation failures, sperm looks fine, we don't kind of know, I will use that 600 if we can financially, for 3 or 4 months beforehand. And it's a really big consideration because you want to work with your patients. And I would rather sometimes I write 1 to 2 because the ones that I use are 300s. And they say, what do you mean 1 to 2? And I'm like, if you're feeling rich today, you could have 2. But if you're just feeling normal, go with the 1. So even though I like them and, if their weight is higher, their BMI is higher, if they're over sort of 90 kilos, I mean, their kind of research is saying give them 900. I rarely use that. Again, I'd want to see real bang for my buck. I'd be extra disappointed if the quality wasn't as good. So there definitely will be some people that are open to that. But I think these are all things that you've got to assess your patient as a human, as an individual, and really prescribe personalized medicine.
Yeah, I love what you're saying there, Belinda, about, if you've got a higher BMI, you're going to have to use higher doses of things. You've then got to choose your best bang for buck. But the issue is the BMI. And I get the fight, I get the struggle. I understand it. But without addressing that BMI, without addressing lean muscle mass,
Yeah.
versus fat mass, then you're always hooked into higher dosage of nutrients because of the inflammatory nature of adipose tissue.
Yeah. And it's a really tough one. You know, all my patients are racing against the clock. You know, I mean, I don't have the
Yeah.
luxury really of seeing the 32-year-old who wants to conceive next year, although I did have one this week and I was like, oh, your preconception, bless, I'm so happy. You know, I generally have, you know, we've done 5 cycles, I'm about to turn 41, you know, this is my weight, this is my life. And so we are, you
Yeah.
know, kind of trying to fast track things a lot.
Yeah. Can I just sort of delve on one of those impeders? Is that a word?
Sure.
One of those blocks, those roadblocks, yeah, the roadblocks to success. And you know, you're mentioning people who've gone through 5 cycles, you know, that emotional agony, the incredible stress that, and I will say this, mainly women, but not only women, couples certainly, put themselves through or are put through stress. So if can we just talk a little bit about what else you use with regards to using NR for
Mhm.
fertility management with egg or sperm quality, perhaps ubiquinol, if it's relevant. What else do you use and when?
Yeah, great question. Yeah. So I'd like to think that it's an impossible answer. I'm going to answer, don't worry. I'd like to think it's an impossible answer because I'm tailoring it. You know, it is sort of individualized kind of medicine, and we need to fix
Sure.
up, you know, nutrient deficiencies, things like vitamin D. My gosh, the amount of people that are on high doses of vitamin D because it's just so related into
Yeah.
egg quality, implantation, immune, everything. So, you know, that's definitely kind of looked at. Fish oils, like good quality essential fatty acids, are really important. When we're looking at antioxidants, it's so hard because how long's a piece of string, and people come saying, I'm on this and 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 whatever, and sort of, you know, maybe brands that aren't necessarily amazing, who knows, or doses, and we have to rein it on in. But, you know, definitely ubiquinol, NAC and NR would be in my stable of, you know, older women, IVF support, egg quality, you know, anti-inflammatory mitochondrial health. They would be probably in my top 3 if I had to choose. And the IVF
Gotcha.
doctors who refer to me and or suggest things to patients, a lot of them, that's in the top 3 also. I mean, obviously
Okay.
we're looking at folate and methylation. You know, do they need different types of folate, B12? Super important. Sometimes riboflavins, your little missing link, B2.
Yep.
You know, particularly in older women, lipoic acid in older women. You know, oh my gosh, the list goes on, doesn't it? So, you know, inositol. Sometimes, you know, a lot, you know, we do have insulin resistance a lot. And, you know, particularly if you expand your definition of insulin resistance to be above 8 instead of above 10 or 20, you're suddenly using it a whole lot more. So it's, you know, and that's what I mean by it being very individualized. So you do need to look at a patient's kind of whole health and whole health picture, and then not forget our beautiful basis of diet and lifestyle, but diet, you know. It's so important, and the difference that I see. And if I was just had my science hat on and my patients weren't these beautiful humans who just deserve to have this success, I would go, hey, can we just get you protein adequate for 3 months and do a cycle and see what happens? You know, but of course I'm popping in all the antioxidants and nutrients and things like that at the same time, because I just want them to have the absolute kind of best chance of things working. But I would say 4 months of protein rich diet, you're going to get a huge increase in success in certain populations.
I love what you said then, and forgive me, this is my brain going back to mitochondrial health, but I loved what you said. I just picked up that you spoke about riboflavin, B2. So if we think about NR being the B3 and riboflavin being the B2, they're the 2 main feeders, not the only, but the 2 main feeders to the electron transfer chain. FAD, NADH plus. So it's really like I love just being, and we very
All the
rarely,
friends want to
well,
go
we
together,
really,
don't they? All the friends, all the Bs.
yeah,
They're
yeah,
all so important. Your B6, B9, folate, B12.
yeah,
It's like it's just a B fest.
yeah.
And what's in the multi is usually not enough for these people.
Yeah, but very rarely do I hear a practitioner mention riboflavin specifically. So I love how your mind channels into these certain nutrients to target them. Can I ask
Yeah.
Belinda about herbs? Are there
Mhm.
any herbs that you favour, perhaps even, intercycle,
Yep.
to maybe help manage stressful situations, or any other herbs that you might help with even fertility?
Yep. Look, I love my herbs as well. I think we all do, or anybody who works with herbs loves herbs.
Mm,
So I don't tend to use them in the IVF cycle. I'm a big
gotcha.
believer in, if you're doing IVF, we just don't know those interactions. And of course, there's some that would be fine to use through the cycle. I tend to just make everybody happy. All the doctors that I work with know that I'm not going to use herbs in a cycle. So they'll always just say, when my patients say to them, "Oh, Belinda's prescribed stuff," they're now just like, fine, and they don't even look at it, which is great. I don't care if they do, but they often don't know the brand names and what have you. So we've got a trust thing going that I'm not going to use herbs in the cycle. If they're in charge,
Yep.
they're in charge.
Yep.
Pre-cycle, though, it depends on what we're working on. So patients who we know are going into the IVF setting, I don't care if their cycle's perfect, to be honest, beforehand. Sometimes I say, it's like, if the walls of the house that you're moving into aren't amazing, but you're going to paint anyway, let's not worry about not getting the house because the walls aren't great. So those people might be people who are going to IVF because of the partner might have had a vasectomy, or they're using donor sperm, or there's a reason that they're not going to conceive naturally. So it's not like we're kind of trying to get natural conception going by getting the cycle perfect. For those people, sure, we're often working on the luteal phase. Vitex kind of, probably has to be, I think, a favourite of everybody's. I'm loving saffron for kind of premenstrual mood stuff. I mean, not so much sort of cycle regulation. In terms of stress, like withania, ashwagandha, who doesn't
Yep.
love a bit of that? Look, stress impacts everything, right? I'm a very big believer in helping my patients not to be stressed about being stressed. So I'm pretty big on, I don't want you to be stressed because nobody wants to be stressed and that it feels horrible to feel stressed, but please don't worry about it affecting your cycle. From my sort of understanding, unless it's like severe acute stress, then that's likely the sort would affect your hormones, shut down ovulation, make you miss a period kind of stress, which some people look, definitely that can happen. But it's not most of the stress that our patients are under. I mean, I always say to them, like, you're special, but you're not that special. Like, it's like if this level of stress, not that I'm rating it, it was related to infertility, nobody would have a baby. It's
Yeah.
awful to think people fall pregnant in war zone, in prison, horrifically in assault situations, so that whole, you need to be positive and you need to be relaxed and things, it definitely helps 100%. Right, for sure, it helps. Everything's better when we're less stressed. But adding that onto their plate, if you're stressed and someone says don't be stressed, when did that ever work?
Yeah. Yeah. But I love that practical point there about don't get stressed about being stressed, because everybody has stress.
And women want
That's
to
a great.
hold. Women want to have done something wrong, let's call it, so that they can fix it next time. So that way, then, was it because they exercised too hard, they got hot at the beach? The questions are, I'm like, it's not what you're doing. We're trying to kind of improve certain parameters. I always say, like, I'm gaslighting my own profession, right? It's not what you're doing, but everything, you should do all these things, So we're definitely wanting to improve the bits that we can improve on. And the way that I kind of look at stress, like, yes, I do use herbs in between cycles for stress for sure, is let's try to balance the effect of stress on your body by Would you like exercise? Do you like time in nature? Can you go for a walk without your phone? Could you have a cup of tea outside in the morning before you start the day? You know, we find some pockets of moments in time that they can slide into their day that they feel, do you know what? Yeah, I could sit outside and have a cup of herbal tea without my phone for 5 minutes. Great. Do that. So we balance the effect of stress on the body by creating some joy and downtime. Yeah, that's my philosophy anyway. Doesn't mean it's right.
I love it. Creating joy and downtime. You mentioned diets before. Let's dive into that a little bit. And are there any dietary interventions, even dietary choices, sort of approaches, which will increase NADH plus levels?
Yeah. So yes. So not easily, right? You know, it's not like, oh, you don't need to do the supplement anymore because you ate an avocado or a bit of fish or whatever it is, you know. So but we certainly want to I guess like fluff out what we're doing by having that dietary base there. And you know, people really like to know what to eat. You know, just healthy whole foods just doesn't make them happy. You know, they need to hear individual foods. But anyway, so things that are vitamin B rich foods, so things like avocado and fish, peanuts, leafy greens, eggs, mushrooms, I think are kind of in that list as well. So then those are good. The body can also convert some tryptophan, which is an amino acid from protein, into NAD. So I guess tryptophan could be also considered a bit of a dietary source of NAD. So again, you know, cheese and chicken and turkey and egg whites and pumpkin seeds. And this is great because, as I said, protein we know is one of the major macronutrients needed for egg quality. So we're getting double whammy here on a few things, which is great. Our fermented foods, they can also contain small amounts of NAD. Also improve, I guess, your healthy microbiome in the gut, which helps to absorb nutrients. So I think they say like yogurt and kefir like have some amounts of NAD, but things like sauerkraut and kimchi rank much higher. But again, you know, it's like eating some lentils for iron. Like, you know, I mean, it's not going to get you to high doses diet alone, but it can boost what's there.
I think personally I must have a histamine deficiency because I love, like, I'll just eat sauerkraut and kimchi. I just love them.
If anything happens, I mean, touch every piece of wood to I don't like to prescribe the histamine diet, but unfortunately it does have to happen sometimes. I'm like, if it's yummy, it's high in histamine. Like it's everything I want to eat.
Yep. I will sit down. You know how they give you a tiny bowl of kimchi normally with a Korean meal, and I'm like, no,
yep.
big bowl.
Yeah. I got my gut health is needed.
Yeah, my wife looks at me in disgust. But anyway, can I ask about red flags? Oh, sorry, you go.
The other thing to mention is sun exposure. So from a I say recovering sun addict. No, I'm just a sun addict that knows that maybe that's good in some ways and not good in other ways. So limiting sun exposure can also help to preserve some of your NAD levels. So basically, like when you spend time in the sun, that direct sunlight on your skin, hence why I'm taking NR every day, forces your body basically to use more NAD plus to repair that cell damage from the UV rays. So, you know, that doesn't mean don't go in the sun. Please don't anybody get that message, because I actually would rather give you NAD and vitamin D than vitamin D, you know, and or both. But on the other side of that, heated things that aren't the sun, like so you're infrared saunas or heated, you know, hot tubs and things like that, that raise your core body temperature, that can also increase NAD production. So, you know, get some heat and I guess, I don't know what I was say, wear some sunscreen. I don't know. Look, I love the sun. So, you know, but like, yeah.
Yeah, well, I mean, Michael Hollick always says it's sensible sun exposure. It's not about burning your skin. It's about getting the appropriate amount of sun for your skin type to make adequate vitamin D, and then stop it, and then cover up.
Yeah.
And then if you wanted to, put some sunscreen on or whatever. But don't go out.
Right.
Don't put the sunscreen on before you go outside, because you're not going to be making vitamin D.
Yeah. Well, if you're doing it in the middle of the day in the burning hot sun at the beach, fine, but you don't just put it on. Yeah, but again, like you said, it's your skin type and things like that as well.
Yeah.
So, you've got to
Yeah,
look at all
yeah.
those things. But yeah, too much sun exposure. I mean, we see it on the skin, right? I mean, like, that accelerated sort of aging of the cells, is basically like depleting your NAD stores. So,
Yeah. But that's
got to look
really
at all these.
an interesting it's a really interesting point, though, about using NAD or NR, to help to prevent the damage that might be caused by
Mhm.
the excess sun exposure. Obviously, the point is stop this excess sun exposure. There's so
Yeah.
much more that we could go into, Belinda.
Yeah.
I wish we had more time. But look, I thank you so much for taking us through just some of the points of NR today. We're always going to say it, nicotinamide ribose.
That's it.
So I thank you so much for taking us through some of the most important points that we need to remember with regards to fertility today. Obviously, people can learn a lot more from you. I do have one more question. Forgive me. I was going to
Yeah.
ask this earlier. Red flags. So with regards to nicotinamide, we were talking about tryptophan. I
Mhm.
know this is going to be rare, but those people who may suffer gout, for instance, do you have any other
Mm.
red flags or hesitations to NR?
Yeah, good question. I haven't come across any, and that
Gout would
doesn't
be
mean that
my
there
only
aren't
one,
any.
I think.
Please don't order self-prescribed because Belinda said that there wasn't any contraindications or red flags. But there's nothing that like comes up in my head that's like, oh yeah, no, I've got to be careful of X when like with NR. So it seems to be pretty well tolerated. And there is an inpatient subgroup that I'm not using it for. Now that you've asked that, I'm obviously going to go and have to research that and feel terrible if there is. But
Sorry.
oops, sorry, no, we all
No,
learn something every
no.
day.
Well, I agree with you. Like
Oh,
nothing comes to mind except for gout,
yeah.
and even those is
I,
usually high dose.
yeah, I mean, I guess my patient subgroup that I'm using, it's not a very gouty population, so I haven't
Mm,
actually had
yeah.
the even the clinical experience to go. Oh, sorry,
Oh, there you go.
few.
That's confidence moving ahead. But Belinda, thank you so much. Thank you so much for taking us through some of the more important points with regards to NR and fertility today. I know there's a lot more to cover, but you've covered the most poignant points for people and practitioners, patients and practitioners, to move ahead with their therapy safely and
Right.
effectively. Thank you so much for taking us through that today.
Thank you so much for the conversation and having me.
And thank you, everyone, for joining us today, obviously. You can find out the show notes to today's episode and the other podcasts on the Designs for Health website. I'm Andrew Whitfield Cook. This is Wellness by Designs.